So here we are spinning out platelet-rich plasma with a double spin system. I withdrew 55 milliliters of blood and about 5 mLs of the anticoagulant that the system provides. And now I'm balancing out with the centrifuge. I try to get it within 1 gram of difference. We're going to do the first spin at about 2 minutes, 4,400 rotations per minute. And we separate out the plasma from the red blood cells with the buffy coat between them that contains the platelets. And above that you have the plasma, and below that you have the red blood cells and white blood cells. So to get leukocyte-rich PRP, we're taking a little bit of the blood in there to make sure that we get all of it. To avoid the leukocytes, we're going to stop before the blood gets into the tube. And here I'm aspirating carefully to avoid red blood cells from coming up. Occasionally you will get some red blood cells just by the nature of the process, whether intentionally or unintentionally. The good news is if you get the red blood cells, you're probably getting all of the platelets, but the red blood cells can be inflammatory. So just keep that in mind. You might want to provide some sort of anesthetic if appropriate, depending on what you're doing, or a nerve block. So here is the plasma that contains the platelets, and now we're going to inject it into the second cartridge or tube for the second spin, in which we separate the platelet poor plasma from the platelet-rich plasma. And with this system, we have to put a stopcock on the bottom to avoid it from spilling out. And we're doing that with the saline as well, which we just weighed out right now. So we're going to spin the second spin for 4 minutes at 4,400 rotations per minute. Here we have our plasma with the platelets settled at the bottom. I'm removing the stopcock at the bottom. And every system is different, of course. Not every system looks like this or works like this. But this is a pretty well-known system that I've used for years, and it works pretty well. So here we're aspirating out the plasma with the platelet poor plasma. And we're going to leave about 6 or 7 milliliters of volume left in the tube, in which we're then going to suspend our platelets in. And you need to be cautious about this. You don't want to be too aggressive and activate all the platelets or even have any sort of trauma to the cells, but you need to get them off of the walls of the tube. In addition, the platelet poor plasma is also quite useful. There are factors in there that can help reduce inflammation and pain, which lately I've been using more and more of. So here I'm just gently suspending the platelets in the plasma. I'm looking at the bottom where you can see some residual platelets at the bottom. I'm trying to get them off the wall, and then I'm going to aspirate out the plasma with the platelets suspended in the plasma, and now it's ready for use.